I've done triathlons for years and I had noticed some increased pain in my left arm. When I was reaching for a saucer out of my cabinet, I couldn't grasp it. The pain was too intense. So I sought out medical help.
So the most common reason to have spine surgery is degenerative disease, usually pinching the nerves, causing pain, whether it's down the arm for neck pain or down a leg for low back pain. Neurosurgery involves surgery of the brain and the spine. There's a broad range of what surgeries are for, but my main focus of interest is minimally invasive spine and complex spine surgery.
I wound up being a patient of Dr. Munson's about a year ago. I had 2 cervical discs that were herniated and impinging on the spinal cord, which was causing the numbness and tingling into my right hand, and it was getting to the point where it was impeding on my grip. And we discussed about a fusion, but when he mentioned the disc replacement, that sounded more agreeable to me.
There's a gap between the bone that needs to be filled, and the traditional way of doing that would be to place a bone graft and a plate and screws, and then those 2 bones grow together over time. And it works very well, but you lose motion at that segment, and patients are worried about the range of motion of the neck. So the alternative is when that disc is removed, you place an artificial disc between the bones to preserve the motion, and we're seeing patients having less future surgery.
He was very down to earth. When I asked what he would do if it was his family member, he honestly was open about how he would proceed.
Minimally invasive spine surgery. Originally, the benefits were thought to be strictly decreased pain after surgery, and it does do that, but there are many other advantages. The benefit of leaving the muscle attached to the spine, there's significantly less bleeding. The infection risk is about 10 times less. There's less pain, faster recovery.
2 days in the hospital, those fine motor skills were right back. I was back to work in 6 weeks. Look over my shoulder, I can take in a performance without having to turn the whole body. It's like being normal again.
After 6 weeks, I was running. To be able to unload the dishwasher and put the dishes in the cupboard and not have that pain. Overall, it's just made a huge difference in my life. To be able to do those small things means a lot to me and my family.
I've had people just ecstatic that they are able to do everything they were doing before. The family members are equally thrilled, and that's why I went to school and trained for as long as I did to see things like this.